Welcome to 12 to Your Health. I'm Dr. Derek De Silva. Last week we talked about the new and better options related to knee replacement surgery. This week we're going to focus on the hips. Are you considering hip replacement surgery but still have a lot of questions? Well, hopefully we can help you clear that up with Dr. Nicholas Alexander. He's with Mahwah Valley Orthopedic Associates. Thanks so much for joining us once again.
Thanks for having me again, Derek.
So, hip replacement, is there anything new?
Oh, there's a lot of new things. We're very fortunate now with the new hip replacement techniques with minimally invasive surgery. We don't cut the muscles, we actually split them. The surgery's gotten a lot quicker with less blood loss. The rehabilitation protocols are a lot quicker, so we get patients out of bed immediately after the surgery, and hips are going to be lasting a lot longer, maybe 25 to 30 years now with the new bearings.
And we have some video that I'd like to bring up in just a little bit, but oh, okay, go ahead. Talk about this and tell us what we're looking at.
Sure. Basically, we're seeing an animation here of a hip replacement surgery. After you do your minimally invasive approach, you're putting in a cup, which is into the pelvis. That's a plastic spacer that goes in between, and that's a metal piece that goes into the femur, and that's the ball part that fits on top, and that can be ceramic or metal. Then we close everything up. The entire procedure takes about an hour and 15 minutes. And basically we get you up within a few hours and get you walking.
Now, when you said we don't cut the tendons and ligaments, what did you say?
We split them.
We split them. What's the difference?
Well, the difference is the healing, the amount of blood loss, the amount of pain involved. The old technology where we would actually cut the muscles resulted in a lot more scar tissue. Nowadays we actually split the muscles and we sew them back together, which results in less scarring, less pain, and better function.
For my patients that I have seen that have had hip replacements, I mean, it's night and day, how they feel, their level of activity. Is it that dramatic?
Well, their pain goes away almost immediately. The pain that came from the hip replacement lingers maybe for a few days, but with the new anesthesia techniques, we've really mitigated the amount of pain to the point where patients within a few days are feeling pretty good.
I mean, I've played tennis with guys that have had hip replacements, and it scares the daylights out of me when I see these guys out on the court, but they do it.
Absolutely. Within, I'd say, 6 weeks, most patients are walking without a cane. They're driving. They're returning back to their pre-surgical level of function.
It's incredible. Hey, thanks so much for joining us. Great information.
Thank you.
Really appreciate it.